Hey everyone, I hope this is finding you all healthy and safe and sane. Let's work on a little bit of NCLEX practice today. So this is a question that one of my students actually shared with me, and we worked together a little bit to help her better think about outcomes. And that's what I want to really make sure that we focus in on today with this particular question. So the question reads, a client is in hemorrhagic shock from injuries sustained in a fall. It is most important for the nurse to take which action? A, obtain vital signs. B, administer 0.9% sodium chloride, IV. C, identify the source of bleeding. And D, elevate the head of the bed 30 degrees. So the first thing that we always do with our tootRN 3-step is the ask, right? And the question really is just asking us the most important action to take. So plain and simple, what's the most important thing to do? And I stress this because here we have priority terms. And remember that when we're dealing with priority questions, it means that it's the one thing here out of our options, right? A through D. What's the one thing here that we have to do right now before anything and everything else in order to avoid the worst potential outcome? Okay, so the next thing, of course, is our problem, and it's telling us we have a client who's in hemorrhagic shock from a fall, an injury from a fall. So we know what does that mean? That this client is bleeding out, right? They're losing a lot of blood from this injury that they sustained. So when we're starting now to think about outcomes of the problem and outcomes of our answer options to find those solutions, we gotta always think about, well, what's happening? So this person is experiencing severe blood loss. So we're looking for the action that we have to do right now for this patient in order to avoid the worst potential outcome. And of course, in this patient, that would be death, right? They're losing so much blood that they're losing all of this volume, they're losing the ability to perfuse, and of course, that is life-threatening. So let's look at our answer options here. A says obtain vital signs. So thinking about outcomes, we can get their vital signs. Sure, we can get blood pressure, respiratory rate, heart rate, temperature, pain. We can get all of that. But does that do anything for this patient's hemorrhagic shock and the fact that they're losing all of this blood? Are we preventing the worst case scenario by taking their vital signs? Nah. So we'll get rid of that. B says administer 0.9% sodium chloride IV. So we can give them normal saline fluids. Thinking about those outcomes, right? Does that help this hemorrhagic shock? Are we preventing the worst case scenario? Well, we know that if we give fluids, right, we provide that IV resuscitation, that definitely helps with increasing the volume. But this patient's experiencing hemorrhagic shock. They're losing blood. By giving them normal saline, are we fixing that issue, right? Are we doing anything for this patient to fix the issue that they have, which is a severe blood loss? No. So that's not going to help us. That normal saline helps to increase the volume, but it's not doing anything for the fact that the patient is losing blood. And if we don't fix that problem, then it's going to continue. C says identify the source of bleeding. So thinking about those outcomes and what that means, if we find out where the bleeding is coming from, can that help prevent worst case scenario from this patient? Yes, it definitely can. So by identifying the source, it does help because then we can stop that bleeding from happening so that we're not losing any more volume, we're not impairing our perfusion, and we're not going down this drain, right? So C is good, I'll keep that. And D says elevate the head of bed 30 degrees. So again, thinking about outcomes, meaning if I do this, what is it going to do for this scenario? So if we elevate the head of bed 30 degrees, what does that do for this patient's hemorrhagic shock? What's it do for their blood loss? What's it do for the perfusion issues they have? What's it do for the volume? Nothing, right? This doesn't help to prevent worst case scenario. So our answer here is C, identifying where that bleeding is coming from. Because if we stop the bleeding, then we can stop all the things that are going to happen as a result of this that of course translate into life-threatening experiences for the client, which can kill them. So C is our correct answer.